The next episode in the Lockdown Drills series shares information about the study being conducted in Maryland on the effectiveness and psychological impact of these drills. So, welcome listeners to the next episode in this topic series on lockdown drills. During this episode, you'll learn about exciting new research happening in Maryland related to the impact of lockdown drills. Joining us to share their knowledge and expertise is Dr. Jerica Knox from the National Center for School Mental Health. Welcome,
Hello.
Dr. Knox.
Hello, happy to be here.
We are very happy to have you and to learn from you today. So, if you could actually start by introducing yourself and providing us with a little bit of information on the center.
Absolutely. So I'm Jerica Knox, assistant professor at the University of Maryland School of Medicine and faculty member at the National Center for School Mental Health, which is housed within the School of Medicine. I'm a school psychologist by training, and my research interests revolve around trauma-informed practices in schools. And so I'm really interested in building school systems that are safe and supportive and healing for students, especially those who experienced potentially traumatic events. And the National Center for School Mental Health is awesome, if I do say so myself. We were founded in 1995, and our mission is to strengthen policies and programs in school mental health to improve learning and promote success for students in the US. So we do a lot of training and technical assistance, research and evaluation. We partner with state and federal agencies. So all in the name of just providing students with safe and supportive schools.
That's great. And Maryland students, parents, all schools are so fortunate to have the university as a resource, but also the National Center. And we thank you for all the great work you do, not just for us in Maryland, but around the world even too. So,
Yeah, absolutely. It's been quite the joy.
yeah. All right. So, MCSS has had the privilege of partnering with you to learn more about the impact of lockdown drills in Maryland schools, particularly. But we feel pretty strongly that some of this research will also have some implications for other states in the country. So, I know a lot of folks are really interested. Could you just sort of begin talking about what research already has been conducted in this area? So what currently exists?
Yeah, that's a great question to start with. So, before conducting this research, we did start off with a comprehensive literature review to see what research exists around this topic. And so we searched research databases to find empirical and theoretical studies around the topic. We pulled from guidelines from national associations to look at best practices for this work. And then we even pulled in some news articles and just other artifacts, right, to provide context for current discourse around lockdown drills and just get the lay of the land. And so there's a couple big findings here. The first one, surprisingly, is that the literature base is sparse, right? With all of that media coverage, news reports that you see with active shooter drills gone wrong, all the things, right? There's not a lot of empirical research that, excuse me, looks at its effects. And multiple sources actually back this up. So the National Academies of Sciences, Engineering, and Medicine actually conducted a consensus study that they published a few weeks ago, and they pointed out that while these drills are common, the literature base is just not there. We don't have enough rigorous empirical research to make conclusive statements around things like psychological impact. And so that was the first thing. Um, with the studies that we do have, there's mixed evidence on effectiveness, just depending on measurement, right? So with self-report surveys, and these are surveys where students are reporting answers for themselves. School staff are reporting on surveys for themselves. These studies that use these surveys show that participants feel more prepared after drills in terms of procedural knowledge and even increased efficacy and confidence in being able to follow the drill steps. But on the other hand, we have observational studies, right? So this is where you are going into the schools, you're taking a look at what's happening during the drill. And those studies, and there's a couple of them, and I do mean a couple, right? Because it is so sparse, um, show that students and staff may not always follow the steps of the drill correctly. So overall, there's this discrepancy in whether they're, excuse me, whether they're effective or not based on measurement. And again, there's just not enough literature to draw conclusions. And then finally, what I'll point out in the literature is that drills can be harmful when not using best practices, and I'll emphasize that piece. So, best practices include things like making sure that you're notifying students and families and staff in advance, making sure that you're providing quality training to students and staff, making sure that you have supports for younger students, students with prior trauma histories, disabilities, all the things. And then especially making sure that you're not using sensorial components with students because it's not needed, right, for the drill to be effective. And that's a really big one because we've seen the media coverage on drills gone wrong where schools have used fake pellets and gunfire and all the things. And so in that context, yes, right, they found that drills can absolutely be harmful and have negative psychological impacts if not following best practices.
That's great. So definitely lots of space for this research study that you're going to kind of share with us.
Yes.
Lots of space there for us to fill.
Absolutely. So many questions that are unanswered
Mhm.
at this point via the
Mhm.
literature.
Great. All right. So, how about you kind of share with us how you're approaching the research?
So again, we did start off with that literature review to help inform how we were going to implement or conduct this study. After that, right, we took the requirements of the bill and what we know and not know from the literature, and we created new surveys for this study. So we have four studies, or excuse me, we have four surveys that we developed. One for students, 6th through 12th grade. We have one for parents. We have one for school staff, and then we have another one that we call the school context survey. And this is more so for one school administrator to fill out. And it's asking demographic variables or demographic questions for the school, getting to know them a little bit better in its context, asking about the drill itself and what occurred during it. What does training look like? And so we developed those surveys because the literature was so sparse and we just had a lot of constructs, right, that we really wanted to look at beyond effectiveness and psychological impact. And so we have five, sort of domains that we looked at in terms of communication, training and education, actual experiences during the implementation, psychological impact, and of course, effectiveness. And I'll say that not everyone received questions for all of these domains just because we wanted to make sure the surveys weren't super long. We rotated some sections so we could, still get a comprehensive picture of what's going on with lockdown drills without overwhelming those, taking the survey. And so we reached out to school districts and said, hey, can you pass this out to your students, your staff members, parents after conducting a lockdown drill?
Got it. So about how long is the survey? About how long does it take a student or parent to complete it?
Yeah, so when we first began, we can look at the metrics on Qualtrics. It takes around 5 to 10 minutes for,
Okay, so not long.
yeah,
Mhm.
pretty short. And I'll also say
Mhm.
that we did this in collaboration with the stakeholders, right? So it's so important if
Mm.
we are developing surveys for us to be able to test out those questions with the people we want to get information from. And so a super special shout out to Student Advocates for School Safety. They are a wonderful group of students that came in. We had 2 sessions with them where we introduced the purpose of the study. We said, hey, this is what we're trying to do. Here's all of the questions that we have developed, but what do you think this question in particular means in your own words, right? So we wanted to make sure that what we were trying to get at with the question is how students would understand it. We asked them, how can we make this question clear for students? We asked them for general input on other questions that we should add, and so they gave us awesome feedback. They were super helpful in helping to refine the measures.
That's great. We love the opportunity to have student voice in these aspects of things. So talk maybe a little bit about how you're capturing that elementary student experience, kindergarten through fifth grade. Are they completing the survey themselves?
Yes, great question. So they are not completing them themselves. we felt it would be best for school staff and parents to provide those reports for them. And so while the student survey is just for 6th through 12th grade students, we do have all parents of any pre-K through 12 um, student attending a Maryland public school to fill out those surveys, and for school staff as well. So we are capturing some information around what those K through 5 classrooms look like. How did students interact with the trainings, or excuse me, with the drills? And so we are able to have some of that information as well.
Great, great. So really every student, regardless of grade level, has some opportunity to be represented. That's
Yes.
really important.
Yep.
All right.
Exactly.
So very thorough approach, very thoughtful, and makes sense to me. So I know that it's been a very limited time frame that the data has been collected to
Mhm,
date.
mhm.
But have you learned anything interesting, particularly in the area of communicating with stakeholders about a lockdown drill?
Absolutely. So, again, that was one of the areas that we wanted to take a look at, communication. And so we did ask a few questions for parents, school staff, and students as well. What we found for parents and school staff, they were usually notified a week or more in advance, where students were notified either the day of the drill or within a couple days prior. Now, this result is coming from the school context survey itself, meaning that parents and school staff, if they were notified a week or more in advance, more than likely they've had time to talk with students about the lockdown drill, see if they have any questions about it, reassure them. So even if schools, right, were providing that notification to students the day of, more than likely they may have had previous conversations about the drill coming up. We also saw that, when we asked parents directly about communication, 64% of them said that their school notified them about the drill beforehand, and 66% notified them after. Um, those percentages can be a lot better, right? The parents need to be notified before and after, not only to help them, prepare their child, see if they have any questions, but also to prepare themselves, right? Parents have experienced drills, and they've either directly or indirectly experienced shootings. And so there may be some anxiety, right? And anxious parents can, make it a little bit harder for them to support their child. And so we do want to make sure that they're being notified in enough time to be able to prepare themselves and prepare their children. And then one other finding related to communication was related to school staff. We did see some differences there. So part of this work was, let's take a look at how often they agree with a particular question or not agree, but also are there differences in endorsing a particular question. And so, as it relates to communication, we saw that classroom teachers reported needing more time to adequately prepare for their role in the drill as compared to non-classroom teachers. And that makes a lot of sense, right? Because more than likely, they are the ones responsible for a group of students during the drill. So not only are they having to um, uh, respond to the drill just with their own behaviors, but they're also having to think about the needs of the students in the classroom, making sure that they are following the steps of the drill. What happens if someone's not calm? And so, generally, what we found there was that classroom teachers needed a little bit more time to be able to thoroughly prepare.
Yeah, I mean that makes perfect sense, right? The teacher knowing in advance maybe to rehearse
Mhm.
or talk through the day before with students the procedure they'd be following.
Yep.
That makes sense. Good. All right. So next, I think domain or area. So what about how schools plan for and prepare for
Mhm.
conducting a lockdown drill?
So we did have a few questions related to planning, training, and education. For planning teams, right? Best practice, you want to make sure that your planning teams are multidisciplinary. You want to make sure that there are multiple voices, expertise, experiences, all the things, so that you can properly prepare for what may or may not happen when implementing a drill. And so, what we found from that school context survey is that 98% of schools included a school administrator on the planning team, which makes a whole lot of sense, right? We need school administrators to, be able to provide their voice on that team. But then the numbers got a little bit lower. So for teachers, 48% of schools said that they were on the planning team. 39% of schools said that their SROs were on the team, 23% of schools for school mental health professionals, and then 5% for community members. So it's a little alarming just because planning teams, again, they should reflect a lot of different voices and expertise to make sure that the drill is safe and inclusive for all students. Just because, school mental health professionals, for an example, they're going to make sure that students' emotional needs aren't overlooked, and teachers are going to make sure that they bring insights into how drills look in the classroom. So without these voices, we essentially miss a huge opportunity to make sure the drill itself is effective and trauma informed.
Thank you for that, Dr. Knox. That is really interesting to look at the alarmingly small percentage of school teams that are including somebody with a mental health background. Hopefully, when we come back together in a year to look at this data again, we're going to see some real growth in that area in Maryland.
Absolutely, a lot different.
Yeah. All right. So the next area. So, what does the data say related to some insights about the students' experience during the lockdown
Mhm.
drill?
Yeah. So generally, they did report being able to follow the steps of the drill. So over 90% of students reported that they were able to follow the steps of the drill easily. And we also provided that same question to school staff, and they agreed that, over 90% of them said that students were following the steps of the drill. One thing that did come up, though, on a different question is that we saw that 1 in 5 students reported that there were some sort of mistakes during the drill. And so we did have some open-ended questions where they were able to let us know what those mistakes or problems looked like. And so they described, students talking, or maybe their phones were out, maybe they were moving around a little bit. And then there were some differences here too. So we did see that middle school students were twice as likely as high school students to report these mistakes, which makes sense, right? So younger students are still developing, self regulation skills. And so this could mean that schools need to give these students more guidance and clear expectations.
Good, and that's positive then, right? Positive results in terms of students being able to follow those procedures. So then next area. So have you learned anything new about whether students, staff, and parents feel that lockdown drills are effective in
Mhm.
helping them prepare for a real emergency?
Yeah, same sort of thing here. So we saw that
Mhm.
majority of participants viewed the drill as effective, that they're getting the job done. I think 73% of students reported drills improved their preparedness, 85% of school staff. Um, there were some questions though in the open-ended responses, right, that indicated they still had some questions. Like for students, they were asking, what about if I'm in a hallway or a cafeteria, right? Different scenarios. And same for school staff as well, right? So what if a student isn't quiet? What do I do? Do I model being quiet? Do I say something, right? So generally, they're feeling like the drills are effective, but there may be some room for improvement. And then there were some differences as well, just thinking about preparation. So we did see that high school students and non-English language learner students, and then those that are not receiving special education services, did feel more prepared than their counterparts. And so there are some differences in the benefits of the lockdown drill and who may receive them. So, and that makes a lot of sense too, just with thinking about accommodations, right? Do we have them in place for all students? Do we feel like all students are able to get the same experience out of this drill?
Yeah, I mean, I think the open-ended comments then are really, allowing you to see some insight
Mhm.
into what's happening beyond just the survey item.
Right, exactly. And then the
Mhm,
survey items, right? They're saying good, could be better though, and those open ended are saying here's why, right? Here's what you
mhm,
can do about this. So yeah, the open ended questions are super helpful.
mhm. That's great. All right, last sort of area, and this very
Mhm.
likely is what our audience members are most interested in. So, what have you learned about the psychological impact of lockdown drills on students and school staff?
Yes. So dun, 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 dun. The good news is that most participants did not report negative psychological impacts. So, 18% of students reported feeling upset or scared during the lockdown drill, And again, we asked the same question to school staff and parents, asking them, did they notice their students or their children feeling upset or scared? 12% of school staff said yes, and only 4% of parents. So generally, good news there. Although there is, that 18% of students who do feel that we would want to pay attention to, and within that 18%, there were some differences. So those students who did feel upset or scared, they were more likely to be a girl, an English language learner, Black, or a student receiving special education services. So a lot of our vulnerable populations were the ones to endorse feeling upset or scared. And this tells us that, these drills may be amplifying existing stress or inequities. So schools need to really be intentional about making drills trauma informed and providing support for students who are more likely to be distressed. And then finally, we did ask school staff the same sort of questions. So, did the drill make you feel worried about your own well being long term? 20% of school staff said yes here. So, again, a lower percentage similar to students. And there was also a difference here where we saw that classroom teachers reported greater worry compared to non classroom staff. So, generally, we saw this pattern throughout the findings where classroom teachers may need additional support to feel safe in the context of these lockdown drills.
All really interesting information. And again, it's going to be, I think, even more interesting, right? As you gather more and more data
Yeah.
year after year here. I do want to, so thinking of sort of that the results of that psychological impact
Mhm.
for folks, for our listeners who may be outside of the state of Maryland, to understand those results have to sort of lay on top of the way we conduct lockdown drills in Maryland, right? So our Maryland schools are prohibited from using any sensory stimuli in a lockdown drill. To
Mm.
your point earlier in our conversation, the replicating the sound of Wi-Fi, activity in a school.
A
Right.
perfect example kind of laid out here, right? When we're using best practices, when we are doing the things we need to do in terms of communication, not using sensorial sorts of components, we expect for the psychological impact or the negative psychological impact to be pretty low. So yeah, great point there.
Yeah, very helpful. So, just to sort of wrap up, I appreciate all this really great info. Any kind of final insights as you've looked at the results overall and what you're maybe looking forward to as you gather more data?
I am so excited to continue this work. We do want to expand our findings once we, have a bigger sample size with the schools across Maryland. We'll be able to take a look at some of those school context variables a little bit more that we asked in that survey to see if there's any differences in context and student and staff and family members' perceptions of the effectiveness and psychological impact of the drills. And it would be awesome if we could do some interviews with school staff and students, right? We did see a lot of meaningful information in those open-ended questions. And so it would be great to be able to have some time to talk with them about that. I'm looking forward to integrating our student advisory group again, sharing these results with them, seeing how we can use them to refine guidelines and how we think about and talk about lockdown drills with students. And so there's a lot of great information that's going to come from this. And right now, the general consensus is that these drills are effective and they have minimal negative psychological impact. There is some variability in those two statements. Just thinking about those vulnerable groups. So I'm looking forward to, just updating Maryland guidelines, continuing examining, and just making sure that Maryland students and staff and family members are able to have drills that are effective and not harmful.
Well, thank you for the work you're doing, and thank you for joining us today, Dr. Knox.
Thank you.
Stay tuned for the next episode in this series featuring the voices of Maryland students.